what are the three types of pain? Okay, so what are the three different ways that we can classify pain? Because you think you may have an idea of what kind of pain you have, but you may be surprised to learn that there are three categories of pain and that you can have more than one type of pain at once. And here's the thing, in my conversations with people with chronic pain, I've noticed that there are really two kinds of people. They either think that they know what's causing their pain, or they have no idea what's causing their pain. So some people, like I said, will kind of, when I start talking to them about their pain, they'll open up by kind of starting to rattle off a list of diagnoses that they have, right? Like things like stenosis, disc herniations, fibromyalgia, small fiber neuropathy, sciatica, plantar fasciitis, migraines, things like that. And then they'll typically share with me all the things that they've tried and how nothing has helped. And they say that's because they have, let's say, the spine of an 80-year-old, or they're bone on bone, and that they can't be cured. They have some incurable disease, dysfunction, or syndrome that can't be cured. And most of the time they tell me, oh no, I know exactly what's causing my pain. It's a disc bulge, and there's nothing that I can do about that. Okay, so we have those types of people. And then we have the other type of people who actually still have never really gotten a diagnosis or never really gotten an understanding of what is causing their pain. Their x-rays and imaging studies have come back normal. Their blood tests are normal or within normal limits. The doctors don't give any clear answers about what's going on. And they imply that you're just depressed, you're overweight, or worst of all, this is all in your head. And there's, here's an antidepressant and a referral to a psychologist. There's no explanation for the cause of their pain. And that in itself is an absolutely terrifying place to be in. And you have to really know why you hurt before you can heal. So whether you're someone who thinks they already know the cause of their pain, who thinks they have an incurable disease or dysfunction, or you're someone who's still searching for answers to why do you hurt, you're going to want to listen into this talk today, because I'm going to be talking about the three types of pain. Okay. So you may think you know what type of pain you have, but maybe you didn't realize that there's a third type of pain that you could very likely have, which can be addressed and could actually help you to start feeling better. Or you may finally get an explanation that makes sense scientifically as to why you hurt, that no doctor has been able to explain before. Okay. So before I dive in, I want you to know who I am in case you're just tuning in. I'm Alyssa Wolf. I'm a chronic pain specialist and the founder of the Chronic Pain Breakup Method. And I've been in the field of chronic pain since 2014. And I was not taught about the complexities of pain in my doctorate training. It was something that I had to learn on my own in my postdoc training and my specialty training. And today, what I'm going to share is foundational to understanding how chronic pain, or pain that's lasted for longer than 6 months, is different from any other ache or injury. Okay, this is something that I had to understand before I could start helping my patients and clients start feeling better. It meant that I had to step out of my comfort zone of traditional physical therapy exercises and try implementing something that you just don't see in the physical therapy clinic. Okay. And after I helped my first patient with chronic pain through these somewhat out of the box methods, I saw my patient's pain and activity level take a turn. My very first chronic pain patient had plateaued in her care with physical therapy and was stuck at that plateau for months. And every day she came in with the same 6 out of 10 hip pain, and it wasn't getting any better. So I was frustrated. She was frustrated. She was tired. And we came to a point where we were both willing to try something a little different. And we agreed to try this new thing together. And sure enough, in just a few weeks, she was able to start feeling better and get back to working full time and enjoying her work full time and playing soccer again, which is something that her exercises were not able to do for her, right? And the reason was because ultimately, because the exercises and other treatments that she was trying were so focused on one type of her pain, but didn't address the other type of pain that she had. So there are really 3 types of pain, and hopefully I can draw this out. Okay, we have nociceptive pain. Okay, we have nociceptive pain, we have neuropathic pain, and we have, oh, you can't see that on there. We have nociplastic pain. There we go. Okay, so we have nociceptive pain, neuropathic pain, and nociplastic pain. Okay, so first is nociceptive pain. So nociceptive pain is pain that is associated with tissue damage or injury. Typically, those are things like ankle sprains, a stubbed toe, a fracture, a bruise, or a muscle strain, things like that. Muscle soreness, facet joints, arthritis, or joint pain, okay? That's nociceptive. Then we have neuropathic pain. Neuropathic pain is pain that's associated with temporary or permanent nerve damage or injury. Typically, this is your sciatica, your radiculopathy, your neuropathy, your carpal tunnel syndrome, your stenosis, right? Then we have nociplastic pain, which is pain that is associated with changes in the nervous system that happen as a result of long-term pain, but can also happen sort of idiopathically, or in other words, without a clear or known cause, okay? But basically, there are well-known changes that can happen both in the peripheral or the central nervous system, so peripheral or central sensitization, that can cause you to feel more intense pain, okay? So nociplastic pain is like turning the volume up on the pain without having any new or bigger injury. Now, here's the part where everyone gets stuck. Everyone wants to pin down what type of pain they have. But here's the thing, before you pick one, the one that sounds most like your pain, I want you to know that you can, and you very likely do have, more than one type of pain at the same time, okay? You can have more than one type of pain. So for example, you can have pain that starts out as neuropathic pain and then over time causes nociplastic pain. So you can have both. You can have pain that starts out as nociceptive pain, or an injury basically, and then over time that causes nociplastic pain. So you can have both. And sometimes an injury or nociceptive pain can completely heal, and then you'll be left with nociplastic pain, okay? And sometimes nociplastic pain has, as I've already mentioned, it can pop up on its own without any previous injury or nerve damage. So here's the thing, like I said, before you reach out to me and ask me, hey, Alyssa, do you think I have nociplastic pain? Because I have the spine of an 80-year-old and I'm bone on bone or whatever. You need to answer these 2 questions. How long have you had your pain? And what have you tried? Okay. If you have had this pain for longer than 6 months and you have tried the traditional treatment methods to treat a nociceptive or a neuropathic pain problem, all of the physical therapy, the chiropractic care, injections, surgery, weight loss, painkillers, nerve painkillers, all that stuff, and your pain remains, you have nociplastic pain. Like, I don't know how else to put it to you, but if you have had pain for longer than 6 months, you have nociplastic pain. You have nociplastic changes in your nervous system that are causing and contributing to your pain. You just do. Like, it doesn't matter if you have the biggest disc bulge or the worst case of arthritis or an autoimmune disease or EDS or neuropathy or whatever the diagnosis is, it doesn't really matter. Even if you have an incurable condition, no matter what, you have a nervous system, you have nociplastic pain, and you can do something about that, okay? There are multiple parts of your pain problem, and you can address those multiple parts, right? So the chiropractic care, the physical therapy, the surgery, the injections, and the weight loss are intended to address the structural and mechanical stuff. Those are going to address the nociceptive and neuropathic sides of the pain problem. But when you start addressing the nervous system by addressing the nociplastic side of the pain problem, you will have more complete relief. And I'm not saying that you will be completely cured or that you'll never have pain again, but you will be tackling the pain from all sides of the pain problem instead of only focusing on one of the mechanisms of pain. So there are, like I said, there are 3 mechanisms of pain. Why would we over and over and over only try to address 1 or 2 of those mechanisms? That's what I help people, my clients with in my program, the Chronic Pain Breakup Method. I teach you a simple step-by-step process for how to retrain your nervous system and why we need to retrain our nervous system. So you don't have to keep living in fear of not knowing what's really going on in your body. So you can know why you hurt, so you can actually start healing, or so that you can gain a deeper understanding of your pain instead of just sitting around convinced that you have some incurable type of pain and there's nothing you can do about it. You don't have to settle with that. Like, you don't have to just sit there and deal with it, pushing through the pain every day to try to get anything done, playing the old energy budgeting game, choosing which activities are more important, and then allocating all your energy for just 1 or 2 of those things, and then having nothing left for anything else, nothing left for any of the fun stuff, none of the stuff that makes you feel joy or fulfilled, right? Like, there is more you can do than just live with it. And I want more for you than that, more than just settling. And it's totally possible to get there when you address the other mechanisms of your pain, okay? So if that sounds like you and you'd like to start doing something about it, instead of just staying stuck where you're at and feeling hopeless and feeling helpless, like there's nothing you can do, your next step is to set up a call with me today. All you have to do is click the link to book a call, find a time on my schedule that works for you. We'll chat about your pain situation, what you've tried, what's worked, what hasn't worked, and then we'll figure out a plan for you that will help you find out your next steps, whether that involves my program or not. I want to help you either way. So these calls will help you get clarity on what you need to do next to start feeling better. Okay, so book a call, find a time, and we will talk soon. Okay, that's all I have time for today. I hope you found this topic helpful. I am signing off until next time.